Difficulty swallowing intro. When a patient says they are having difficulty swallowing, they may be referring to one or a combination of the following symptoms. Dysphagia, which means food is unable to pass through smoothly or gets stuck. Odonophagia, which means that swallowing is painful. Reflux and regurgitation, which means food or gastric secretions come back into the throat or mouth. Aspiration, in which the food or drink goes down the trachea instead of the esophagus. This can further lead to aspiration pneumonia. Gagging, in which patient may feel that the food is causing them to throw up and vomit. Globus pharyngeus, a feeling of a lump in the throat. Xerostomia, it means dry mouth, which may itself lead to dysphagia or odonophagia. Our main goal in this presentation is to discuss an approach to a patient with dysphagia, its relevant history and workup, and what are the main differentials and some general management options for dysphagia. Many specialists have to deal with patients of dysphagia, such as otorhinolaryngologists, gastroenterologists, speech therapists, dentists, internists, and geriatricians, to name a few. Dysphagia is a fairly common cause of morbidity in the elderly population. The swallowing mechanism. Let's begin by reviewing the physiology of the swallowing mechanism. It is generally divided into three phases. Oral phase, in which the food is chewed and lubricated to form a bolus. Pharyngeal phase, in which the movements of the soft palate, larynx and epiglottis separate the air passage from the food passage so that food and drink are not aspirated into the nose or trachea. Esophageal phase, in which the food passes down the esophagus via peristalsis into the stomach. A disruption in any one of these phases could result in dysphagia, and difficulty in the pharyngeal phase especially could lead to aspiration. Classification of dysphagia. Dysphagia is classified according to site, whether it is oropharyngeal or esophageal, and the type of disorder, whether it is a structural disorder or a motility or propulsive disorder. The differential diagnosis for dysphagia could also be divided according to the cause: congenital, infections, trauma, inflammatory, autoimmune, neoplastic, neurological, motility disorders, iatrogenic, and mechanical causes. History and workup. So as you have seen, a multitude of conditions can cause dysphagia. When a patient presents with difficulty swallowing, here are a few important points to consider in taking the patient's history. Is it true dysphagia, or other related problem like odonophagia, etc.? What is the onset and duration? Any coughing or airway issues, to check for aspiration? Is it continuous, worsening, or intermittent? What is the location? Is it oropharyngeal or esophageal dysphagia? Is it more for solid food or liquids? Is there associated regurgitation or reflux? Does the patient have pain, weight loss, and/or dehydration? This is to assess the general condition of the patient.